My name is Amy Ford. I've been a registered nurse for 17 years. I'm from the small town of Williamson, West Virginia, where I've lived my entire life, the daughter of a nurse and a coal miner. Even though I was the youngest of 4 children, I was always somewhat of a caretaker. It came natural for me. So it felt right to follow in my mother's footsteps and become a nurse. And this March, when COVID-19 sent our country into crisis, I knew I had to help any way that I could. I deployed to New York in April and then to San Antonio, Texas, working as a COVID relief nurse in both states. As I contended with the challenges of treating our patients who had their worlds turned upside down, I noticed a positive change in our healthcare system. President Trump recognized the threat this virus presented for all Americans early on and made rapid policy changes. And as a result, telehealth services are now accessible to more than 71 million Americans, including 35 million children. Prior to COVID, telehealth was not covered or reimbursed under Medicare, Medicaid, or CHIP. This left our most vulnerable populations with no other choice but to have an in-person office visit with their physicians, increasing their risk of exposure to COVID-19 exponentially. The expansion of telehealth services has also resulted in the integration of video visits between patients and their families, allowing loved ones to have contact and visualization, as well as a better understanding of care. Telehealth has been essential during this pandemic. I don't want the media taking my personal story and twisting it, so let me be clear. As a healthcare professional, I can tell you without hesitation, Donald Trump's quick action and leadership saved thousands of lives during COVID-19. And the benefits of that response extend far beyond coronavirus. Telehealth will continue to aid many that are just unable to find transportation or a way to the doctor for regular checkups. This is especially true in rural America. I live in a town of about 2,000 people. We do not have buses, trains, trolleys, or Ubers available to us. In addition, the unavailability of services can also hinder treatment for many. So increased access to telehealth for millions of Americans has truly been life-saving, and we have President Trump to thank.
From the very beginning, Democrats, the media, and the World Health Organization got coronavirus wrong. The World Health Organization said, authorities have found no clear evidence of human-to-human transmission.
Overall, most people should not be terribly concerned about it.
Everything is fine here. We do want to say to people, come to Chinatown. Here we are. Come join us.
We don't even think it's going to be as bad as it was in other countries.
Go about your lives. Go about your business.
One leader took decisive action to save lives. President Donald Trump. Banning travel from China and coronavirus epicenters. Biden charged xenophobia. But President Trump was right, signing the CARES Act, providing immediate relief to American families, workers, and businesses, declaring a national emergency, tapping into $42 billion in existing emergency funding, quickly getting crucial personal protective equipment to the states, signing the Families First Coronavirus Response Act, ensuring that American families and businesses impacted by the virus receive the strong support they need, launching Operation Warp Speed to fast-track a vaccine in record time.
He said everything that I could have hoped for. Promise made, promise kept.
He is ready, willing, and able to help.
He has been responsive. He's done a lot of good things.
What the federal government did was a phenomenal accomplishment.
In our hour of need, you all literally are helping us in a big way. We were at the edge, and this is life or death stuff, and we're forever thankful for that.
Soon, we will emerge safer, stronger, and greater than ever.
I am Dr. G.E. Ghali, an oral and maxillofacial surgeon and chancellor of a large academic medical and research center in Louisiana. I feel uniquely positioned to share how President Trump's decisive leadership led to a rapid and efficient response to the coronavirus pandemic. I know this as a health professional and as someone who has recovered from COVID himself. The COVID-19 pandemic exploded into our great nation with an intensity unparalleled in history. But our medical investigation and drug development systems were not designed for a pandemic. The devastating effects of the coronavirus demanded immediate changes at the regulatory level. A prompt response led by President Trump cleared away the red tape that usually makes drug approvals a long and drawn-out process. By harnessing the resources of the federal government and the private sector, President Trump's Operation Warp Speed is accelerating the testing, supply, development, and distribution of therapeutics, diagnostics, and very shortly, effective vaccines to counter COVID-19. Let me give you 3 clear examples of how President Trump's leadership removed regulatory barriers so COVID patients could have faster access to effective therapies and diagnostics. First, on February 26, 2 phase 3 clinical trials studying remdesivir were initiated. Just 2 months later, the FDA approved remdesivir for emergency use to treat COVID-19. Normally, this is a 3 to 5 year process. The amazing speed with which this happened in a safe but efficient manner is unheard of. Second, the FDA granted expanded access to COVID-19 convalescent plasma. Within 24 hours of this approval, we were administering convalescent plasma and remdesivir to a critically ill patient, a former Army Ranger and physician. Had it not been for the rapid deployment of these medicines, this patient, who is my colleague and friend, would have surely died. And third, at the end of July, I developed a fever and cough. I reached out to our testing team and received one of the Abbott rapid tests, yet another tool quickly approved by this administration. Within 15 minutes, my test came back positive, and within 4 hours, I was receiving my remdesivir doses, followed by an infusion of convalescent plasma. As a physician, I've seen firsthand how these breakthroughs have saved countless lives. As a patient, I've benefited from the expedited therapies made possible by the swift action of this administration. President Trump truly moved mountains to save lives, and he deserves credit. Thank you, President Trump, for providing timely access to critical diagnostics and therapeutics during this pandemic. Thank you, Mr. President, for your strong leadership in these challenging times.
When the China virus invaded our country, we launched the greatest mobilization of American society since World War II. Patriots of every race, color, and creed rallied together to defeat the invisible enemy and save the lives of their fellow citizens. Today, our hearts overflow with appreciation for the incredible frontline workers who risk their own health and safety to keep America strong and safe. When crisis came, millions of everyday Americans rose to the challenge. In their actions, we see true greatness of the American character. We always find a way to victory. History will remember and celebrate the heroes of 2020 for as long as our great American flag waves over the land that we love. To every frontline worker, I offer the salute of a nation that is forever in your debt. Thank you, God bless you, and God bless America. These are my friends. These are the incredible workers that helped us so much with the COVID. We can call it many different things, from China virus. I don't want to go through all the names because some people may get insulted, but that's the way it is. These are great, great people, doctors, nurses, firemen, policemen. We want to thank you all. You have been incredible, and we want to thank you and all of the millions of people that you represent. Thank you all very much. Great job. Thank you. Thank you all very much. So tell me a little about your stories. How about we'll start with you?
I'm a postal worker, delivered to the senior community during COVID-19.
Good. And we're taking good care of our postal workers.
Absolutely.
That I can tell you. Believe me, we're not getting rid of our postal workers, you know. They'd like to sort of put that out there. If anyone does, it's the Democrats, not the Republicans. I want to thank you very much and thank everybody in that whole beautiful post office system. We appreciate it.
Thank you.
How about you?
I'm a trucker.
Good.
Own a small business in Ohio.
Great.
Hauling steel mostly. You know, some of our customers actually made hospital beds with some of the material.
That's fantastic. Well, congratulations. I love the truckers. You know, they're on my side.
Thank you.
I think all of them, frankly. I think pretty much all of them. How about you?
I'm a custodian at the post office as well.
What do you do exactly?
Clean up everybody's mess and everybody's germs and all that.
Can I tell you, that world, that profession will never be out of business. You know that,
for
right?
Sure.
Thank you very much for being here.
Thank you.
And how about you?
I'm a registered nurse, President Trump. I work at a New Jersey hospital. It's called Virtual Willingboro Hospital.
Right.
I also represent an organization of professional nurses. It's called the National Association of Catholic Nurses.
Very good.
But I want to tell you, sir, as a nursing supervisor, I am so in awe of your leadership. Honestly, I know many people have said often interesting things, but it takes a true leader to be able to ignore all that stuff and do what is right and not be offended by all the words being said. And you really do show that positive spirit to us. And as nurses, I appreciate that. But just as an individual, I'm grateful for that.
Well, I'm for the nurses. I'm for the doctors. I'm for everybody. We just have to make this China virus go away, and it's happening. Please, go ahead.
I'm also a nurse. I represent Genesis Healthcare, which is a skilled nursing facility company. I want to thank you and your administration for all the supplies and support and funding that you've given the skilled nursing units. Without that, we couldn't do as well as we have done. I spent some time in New Jersey. I live in West Virginia, went to New Jersey and did some work there, and we finally started to see things change and turn around.
I appreciate what you said, because we have delivered billions of dollars of equipment that governors were supposed to give, and in many cases, they didn't get. So the federal government had to help them, and all of the people that did this incredible work, they never got credit for it. But you understand where it came from. Thank you very much. Thank you both. It's really nice. Please, go ahead.
I'm a police officer in Englewood, Colorado, and I contracted COVID in late March and recovered.
That means we don't have to be afraid of you at all, right?
I'm good to
Once you're recovered, you know, we have the whole thing with plasma happening. That means your blood is very valuable. You know that, right? Thank you very much. Great. Please.
I'm a detention deputy at the Kern County Sheriff's Department out in California.
Great.
And I also contracted COVID end of March and recovered from that also.
How long was your problem?
I was sick about 10 days, really bad. I got everything besides a cough, but recovered. I was off work for a month and a half, and I work in our local county jails.
Did they do anything specifically to help you recover?
They gave me Z-Paks medication, cough syrup.
Okay, and I won't even ask you about the hydroxychloroquine because it's a shame what they've done to that one, but I took it. I took the Z-Pak also, and zinc. I want to thank you all very much. It's an honor to have you in the White House. You're fantastic people, and the people you represent an incredible group of people, and we love you all. Thank you very much. Thank you very much. Appreciate it.